want to tell you about what a trigger point injection is. You see, scar tissue, when muscles over time are very stiff and very rigid, then they start to get poor circulation. And what can happen is that tissue can start to develop deep scar tissue between the muscle fibers. And you see, when I come in and I try to work this stuff out with my hands, I can only get so far. And so how a trigger point works is that it is a medication that is 99% saline, which is essentially salt water, and 1% of the stuff that numbs your gums at the dentist called lidocaine. Okay? Now what happens is, you see, when you inject that knot, that trigger point, what happens is that fluid expands these muscle fibers and it breaks up scar tissue 5 times faster than massage and physical therapy and anyone working that spot out. And so the best thing is this, is that we all understand as doctors that we have a limited amount of time with you to try to rehab you and improve years and years of poor posture. And you see, if I see someone for 12 visits or whatever, okay, well, I should have 12 hours to try to strengthen muscles and try to correct what could be 20, 30 years of poor posture. And you see, the worst thing about that is that if I spend the first 30 minutes of every visit just massaging and trying to dig into your shoulders, then guess what? You just cut down the time that I can take someone through exercise and actually fix you, okay? And so trigger point injections do what takes me 30 minutes in 2 minutes, and it's 5 times more effective. And so these injections instantly knock out people that have migraine headaches. It knocks out muscle spasms that can be referring down someone's arm or down their back or in their glutes. These things are amazing. And they not only do they feel great, okay, because it's just a small, pretty much acupuncture needle, you really don't even feel it, but the relief that you get that's instant, and then all of a sudden I can push you and actually get you through exercises. You see, we're a different office. We're not someone that's just gonna slap some ice and heat on you and have you sit on a table for 30 minutes and then we'll move your arm for you, knowing that that's just gonna delay how long it's gonna take to get you well. You see, we're under the mindset that we're gonna work you. We're gonna strengthen these muscles. You're here and you're paying us to change your life. And so things like trigger point injections cut through the pain and they get us right into the area where we can start strengthening you and actually fix the underlying condition. And not only get you out of pain, but prevent you from getting it in the future.